tuberculosis is a disease of barriers to care. It's not a disease of borders. And underfunded TB care puts everyone at risk, not just those groups who are the most vulnerable. And universal access to TB care, covering all costs for people who are at risk of TB or who have TB, is much cheaper than dealing with outbreaks, dealing with people hospitalized with TB and emergency responses. Well, the province of Quebec, and particularly Montreal, has been seeing a rising number of people developing tuberculosis, becoming sick with tuberculosis over the past 2 years. So in 2024, Montreal's rate of TB jumped by 54% compared to 2010 to 2023 average. And so that's not a fluctuation, that's a reversal of progress. Well, it's not about a single outbreak. It reflects deeper structural issues in how TB is prevented and detected. And ultimately, the groups, the people are co-citizens who are most at risk of TB are the ones who have the most difficulty accessing healthcare and getting access to the tests, and even sometimes the treatments needed for treating TB. Yeah, TB is curable. Almost all of the tuberculosis, the type that we see in Montreal and Quebec and in Canada, the usual medications work for it, so it doesn't have resistance to the easily accessible medications, and we have very high rates of cure. What's particular about tuberculosis that's more difficult for people when they become sick with it is that the treatment, unlike a pneumonia from a bacteria where you take antibiotics maybe for 5 days, for tuberculosis, you have to take the pills for 6 months, sometimes 9 months, sometimes a year to really get rid of all the bacteria in your body. And one thing that's particular about tuberculosis, it's the only disease whose treatment can be forced by law. So anyone who develops tuberculosis and becomes ill with it doesn't really have a choice but to take the medications. Sure, well, TB is caused by a bacteria, and it's transmitted in the air. So in order to get sick with TB, someone needs to breathe a droplet of water that contains the bacteria, and we inspire that, it goes into our lungs. And for some people, it can establish its presence in our bodies, and that can lead to us becoming sick and having symptoms of TB. And then through coughing, putting it back into the air where other people may breathe it and themselves become sick. But I have to say, TB is not that contagious. So there's no need to have this huge panic about TB, even though the numbers are rising. It takes several hours of breathing in air that has TB in order to become sick and developing the disease. Sure, well, in Montreal, it's really where global tuberculosis meets local realities. So tuberculosis, it does touch upon issues of migration, housing insecurity, and gaps in access to care. They all converge, and that's the populations where we're seeing more affected by tuberculosis. And it's a transmissible disease, so it's really something that should concern all of us. So while I said tuberculosis is curable, that means that we can erase the bacteria from the body using antibiotics, but it can still leave lasting scars in the lungs. So, you can be left with changes to your lungs, even to your heart, to your blood vessels, that can leave you a bit more shorter breath, or very much more shorter breath when you're trying to do day-to-day activities. And those kinds of effects can last a lifetime. So it's really in our interest to try to prevent tuberculosis and to try to make sure that people are cured quickly and effectively.